Initially, as the epidemic was localized in China for quite a while before the World Health Organization declared it a public health emergency of international concern. And then, almost about 3 months ago, it was declared a global pandemic. So we are into the 12th week since that declaration. At that time, we had said that it's not a matter of when, but a matter of if. Since then, we have reported our first case in mid-March, and since then our numbers have been swelling. And today we are almost hitting the 3,000 mark of positives. According to our experts, our epidemiological curve is rising sharply in many of our regions, implying that going forward, we are likely to record increasing numbers of positives and more people requiring clinical management. Just to give you a perspective on these rising numbers, if you look at the first 8 days of June, in total we have registered 900 positives in these first 8 days of June. These from a pool of 19,461 samples tested. If we now go back to the month of May, the first 8 days of May, at that time we had recorded 225 positives from a sampling pool of 8,872 tested. You can see clearly that it is not a simple linear mathematics now, but rather we are beginning to see a rise in the numbers. Hence, we face a challenging but not hopeless situation, for as long as our approach to defeating the virus is being steadfast on the measures that have been imposed and maintaining solidarity in this approach. We have no choice but to work together, share resources, and deploy the proven strategies that we have learned along the way, which is the only way out. We have learned a lot about COVID-19 since our first case, and today I want to focus on a few lessons that I believe are important in dealing with this pandemic. The first one, of course, is the key weapon of fighting this virus, and that is the measures, containment measures that have been put in place, the hand washing, personal hygiene, the wearing of masks, social and physical distancing, avoiding public gathering. These are the measures that we have continued to preach and will continue to preach. They have worked in other places, and adhering to them, we can ensure we can suppress this curve of ours, flatten it, as they call it. And this is because the virus is carried mainly by human beings, which is why also staying at home directives have been put in place for those who can, in order to limit human movement. And these approaches have been applied in many of the countries that have been ravaged by the pandemic, and they have worked in those countries in suppressing the spread of the virus. So that is the first lesson, is we really need to keep the course. We need to be steadfast in observing these measures, inconvenient as they may seem, and they will require us to make sacrifices in order to be able to observe them, but they do work and they will be able to keep the spread of the virus down. However, when we stay at home, we have seen where, for instance, stay-at-home restrictions that were placed in some countries and some of the measures that we have mentioned have been lifted. There was an upsurge in the number of infections. I think most of you are familiar with what has happened in a number of countries that had managed to suppress the virus. But on easing some of these measures, there was a resurgence or spikes in the infections. That is why, as a country, we have been very cautious in our approach towards easing of the measures. And I think all of you heard His Excellency the President when he spoke on Saturday, and he gave the reasons as to why some of these measures' time may not yet be there with us.